beautiful people. My name is Adeniji Ayodeji David from Nigeria. I am a community rights advocate in Nigeria and also doubles as an epic champion in Nigeria and also a community connector to the Global Fund and a key population in Nigeria.
Hi everyone, I'm Livy van Wyk from Namibia, the founder of the Namibian Network of People Living with HIV.
All right, so we're here live at the PLHIV Integration Summit by GMP Plus in Ghana, and also it is ICASA, and we're talking about integration. I'm going to just share some experiences from Nigeria.
Yeah.
When we talk about integration in Nigeria, currently the PEFA state, as we know, we have PEFA states, we have the Global Fund state. So in the PEFA states in Nigeria, we have harmonized our data to the extent that it is called SIMS, and the SIM is just to ensure that all names is on the EMR. You can easily access treatment in any facility where you find yourself in any local government. It's not a matter of you coming to another state or coming from somewhere far to access treatment. In case you don't have the fund at your hand, you can just go there and tell them, oh, you're here to access your treatment. All you need to do is just thumbprint, and then it brings your data. And at the back end is also giving them a feedback that you've gotten your medication. And also another beautiful thing at the moment that is happening is we are trying to put our people on health insurance, and we are enrolling PLHIV into health insurance because it is not all about HIV alone. People need to also access other treatments such as STIs and all the things that are no more there, and we're trying to like make the government own the services to them, and by bringing them into the basic health fund. There is something called basic health fund in Nigeria, and this is utilized to put people on the insurance scheme. So we bring them under the insurance scheme, and then it covers for every other health things you want to do apart from HIV. So you can go there for malaria testing. And we know our people are fond of not wanting to go to the primary healthcare center to check when they have malaria. They prescribe themselves. They don't know everything. So this could cover up for everybody, and it is accessible and affordable for them when they are enrolled into the insurance. At the moment, I think these are the two things that have stood out for me in Nigeria.
Yeah, that's really nice to hear. In terms of Namibia, I like the approach of the community-led monitoring, which is championed by young people themselves in terms of seeing, what kind of services are actually working for young people, in terms service uptake, in terms of, testing, ARVs, and now that we also have PrEP, into this system. It's just beautiful to see that, things are, government is allowing young people to, champion their own, health issues, especially when it comes to HIV prevention and care.
Okay, I think another beautiful thing about the Nigerian part is there is something called GHR, that's Gender and Human Rights. It's funded by Global Fund, and we have community advocates to institutionalize the anti-discriminational bill. This is a platform whereby people can report issues around gender-based violence, stigma, discrimination, the fight for their rights. And then it is also a platform whereby we allow people to know about their rights, know what they can access, and knowing the in-depth of the anti-discriminational bill that has been passed. And it's also encourage our people to be free from self-stigma, because you already have a backup, you already have something to back you up if people stigmatize against you, apart from you stigmatizing against yourself. Another beautiful thing is also the peer-to-peer networking that the network has put down. We have support groups that are running. We have the Operation 000 for the adolescent and young persons, whereby we discuss issues around their health, they discuss issues around disclosure, they discuss issues around relationship, aging beautifully with HIV, and also it is also a platform for them to learn and be empowered.
Yeah.
So in terms of empowerment, the only problem there now is what we are integrating is the key population aspect of it, because Now they've taken away the OSS, who happens to be the safe space for the key population, and leveraging them to be community centered, and now bringing everybody to their orientation to be male and female. You know, it's not going to be easy to take somebody that physique themselves to be I am she, her, and then you want me to start bearing I am he, him,
Yes.
male, female, male, female, and it's just a crazy thing. And then the access to the OSS has been taken away from them. And I think the OSS is not just a center to access care; it is a center for well-being, wellness, peer-to-peer communication, conversations. It is also a center where you can get informations. It is also a center for your mental wellness.
Yeah.
But when you are restricted from coming to where you call a safe space, it's bridging a lot of gap, and I feel this gap needs to be looked into while we are integrating, and we are not missing out any part.
Yes.
We are not leaving anybody
Behind.
away, because now imagine for FSW that doesn't want people to know that they are PLHIV, and then you're not bringing my medication to me in the community. It doesn't make me feel comfortable.
Exactly.
Because I don't want people, my clients, to know I am on drug or on medications, as we know that everybody are still living their life in closets. It's not everybody that have the boldness to talk about, and it could increase the rate of stigma and endangering the lives of key populations.
That's really interesting. I remember, when I was young, I think I was, 17, and when I reflect and I look back, how, systems were, discriminating us in terms of, stigma and discrimination in terms of accessing services, and where we are now, it's quite good to see that young people in my country are at the forefront, in terms of decision making and saying, like, this is what will work, what is working for us. And the only challenge that we are currently facing is also in terms of human rights, where certain populations are scared, to access services such as key populations, especially sex workers, trans women. And I think that, an opportunity like this, such as the summit that we are attending, can, create these opportunities where we can discuss and see how we can fight or advocate for more friendlier services, so that nobody is actually left behind. Nobody is discriminated, that services are friendly, accessible, and also the quality. We should remind people that access to services is not a favor. It's a human right. It's a basic human right. And it's people should realize that, like, I should feel free to go to a clinic anytime. You always have to go. What worked for me is through support groups. You will talk to this person and say, where do I go to, in terms of accessing these services. But we don't want to ask people, it is my right to access services, immediately.
I think I agree with you, because there's some part of this integration that I would love to happen in Nigeria. Also, there is this stigma attached to assessing medical health care in Nigeria. There is this stigma when it comes to knowing fully that this person that wants to deliver is PLHIV. They're separating beds and stuffs like that, which we've been advocating for. It was really, really bad to the extent that they segregate the house where PLHIV receive treatment. What happens to bringing it to the OPD, the entrance point? But now we've started integrating, because we now have a testing booth in every entry point of facilities in Nigeria now. And I think it's part of integration that we need to do. We need to ensure that people do not have a different card that specifically show that I am PLHIV. Like having a very integrated, that nobody know who is who or what service I am taking. I want to just come to the facility freely and assess my treatments. Nobody know if that clinic is for people living with HIV and AIDS. Why can't we bring the clinics together and ensure that people just come freely? Because this is the barrier that takes people from one location to another location, because they feel like if I'm in this location, assessing HIV treatments, people know, oh, the people that goes into that room, what they're going there to do is to collect HIV treatment. And stigma is a very big bedrock. While integrating, we need to start looking at how we can curb and reduce associated stigma programming.
Yes.
Yeah, so we need to start looking into how we can remove stigma, correct and concise information for the community to digest. I think a lot of persons living with HIV still do not know what offers are there for them or the services that are there for them. And I think it is very important to allow the community to have an adopt knowledge about what and what is obtainable for them. There, I remember vividly in 2023, specifically, there was this project we did with NEP1. It was called PEEP, that is Patient Empowerment Educational Project, whereby we brought a lot of persons together and we had the national TOT, that's trainers of trainer, and it was packed. It was a fully packed thing talking about stigma, discrimination, talking about health literacy, talking about what is obtainable, talking about your rights, and then we now went back, we stepped down to states coordinators. State coordinator went by to step down to support group coordinators. Support group coordinators now take it to the support group. Another beautiful thing that is happening in Nigeria at the moment that we are planning, it has not been announced, is the PBAT Youth for Health Champion that we're doing. And what is PBAT Youth for Health Champion? Because I am on the board where we are working on it. It is a process whereby we are allowing youth to take actions on their health. Youth being involved when it comes to health, and it's not just HIV. We have the component of HIV, we have the component of tuberculosis, we have the component of malaria, we have the component of SRHR. So we have a module that we're developing. At the stage now, we are having a general meeting very soon where we'll bring all stakeholders. Amazing. So what is it trying to do is we are going to bring trainers of trainers. The trainer of trainer will be like 2 person per state will be coming to the nationals. After training them in the national, they go back to the local government. Two persons from the local government, they will be trained also. The goal is, while training those people, they are also going back to their community. Now we've trained local government. Local government will now go back to their community and train about 200 persons again. Then they now have to go to all the schools in their local government and have school activities and school programming, leveraging and sharing informed knowledge to them. Because we have so many data that are not working, we want to have a unified data, a unified information about HIV, about STI, about SRHR, and every other things, tuberculosis, malaria. It is a model that will be cascaded to everybody. And the goal at the end of it is we have seen that we've trained about 5,000 persons. After training 5,000 persons, one way or the other, you as agree with me that you would share that kind of information on your status. And then during the seminar or during the program, there's going to be a social media storm. And the social media storm is you take a picture of yourself and put a caption of what is going on. Definitely somebody would get interested in getting to know what is going on, and then you're sharing information, and before we know it, information is going wild.
Right, that's right. I think on our side, through the support group, we have really achieved something now, because we did not have a collective voice, in order to advocate for HIV programming in the country. And what is beautiful about the Namibia network of people living with HIV is that we have a very diverse, members that are representing the organization. So each constituency can really advocate for, services or, anything that, hampers access to health as well as human rights. Because I cannot speak on behalf of, a trans woman. I cannot speak on behalf of a gay person. So we have been left behind, as a country, to have that unified voice. So it was almost like people were deciding for us, what services we need. So you can imagine, like, it's like you just come here and you dump these services on us. So I think now we are at this point where we are in control of our lives, and really hold, government accountable, and say, like, this is what we need, this is what we want, and this is how we want it. Not to fight, but to hold hands, and to work. It's beautiful to hear how other countries, have held their governments accountable. But that was only because they had a collective voice. They had a name, they were like, this is
I
us.
don't think
So
it's about having a name. I would love to actually see. I see where you're coming from
Yeah,
there,
yeah.
but I think one thing that Nigeria strategy that we used in Nigeria was, the government, the wife of the governor. So for my states now, the wife of the governor is the network of people living with HIV and AIDS godmother. So they love this crown, they love this awards and things like that. So we present to them. So we bring them to the table,
Okay.
and then we're like, oh, you are the champion for this. So in Nigeria now, the president's wife is the champion for health, tuberculosis, and I think she was awarded. It's not, I think, I knew she was awarded for the World AIDS Day this year, and she has already dropped her statement. So this is how you get the government involved. Let them come closer to you. Let them see what is happening. And then when they, from their offices, they have this slot for empowerment. So when we do is we just call them, hey, hello, mommy. You know, you are our mother. We heard about the empowerment. What is the point for our people? And then another beautiful thing that my network leader is doing is enrolling every PLHIV into the government. There's this book that they have. They have this record that whenever they want to do any empowerment, they go dig names from there for vulnerability record. So we enrolled all PLHIV into the record.
Into that record.
Yeah, so we're doing that at the moment, and we're still doing. So we go put their names into that record. So when there is offer, we just remind them, mommy. So that record does not need to say you are PLHIV, but you are vulnerable. Being a PLHIV makes you vulnerable one way or the other, maritally, physically, emotionally. You can count a lot of vulnerability that comes with being PLHIV. So all these things are what we do to ensure that the government takes part of empowering our people. They take part in sharing out of our pains. And then, like I said, the governor's wife, there is no way or the other the governor's wife will not have access to the husband. And like when they are involved in you, they see your pain, they hear from you, they see your community, you invite, they usually come for our meetings.
Yeah. But in my country, I was talking about having our voices and having a name. It's like more on a advocacy level to say that we are here and stop deciding for us. And some of these policies and government will not challenge themselves. They need to be challenged. And what I want to emphasize and re-emphasize is that we can now, as a collective, also just address some of our issues, because before that we couldn't. That's why you never heard about Namibia. It's like we are not present.
I can imagine.
We are left. I mean, we've been left behind. The world is evolving. We're talking about AI and all that, but our conversations has to be backdated, unfortunately, because now we have to go back and challenge these things from a grassroots level, and then come up and involve government. So now it's possible. Before that, it wasn't possible, because they even told us you must go back and organize yourself, and talk. But it also gave us a good opportunity to say, in our existing support groups, to say, identify key people, that are affected and that can stand as leaders, to say, like, this is our approaches, this is our strategy, and this is where we are heading to as a network.
So I think a part of integration, what we should also look into is data-driven advocacy. I think this has worked for us in Nigeria so much that when the leaders have a lot of things on their table, but when you come with them with an angle of true data, showing we have so number of KP population, PLHIV, we have so number of children, we have this number of this in your vicinity, we have number of death rates, we have this number of. So when you give them evidence advocacy, not activism, they tend to shift and think with you. I remember vividly there was a time we were trying to push for the domesticalization of the anti-discrimination law in my state, and the government were like, is there still HIV? And then when they saw us standing in our numbers and saying, I am PLHIV, you are PLHIV. So the concept in their head was anybody with HIV are always that skinny and they are all skeleton body. And so in integration, we start looking into, I think it works best when you give them evidence-based
Yes.
with data driven. So when we're talking about integration, let's not forget leaving no one behind and integrating for all, because there is nothing for us without us on the table. We don't just want to be a sitter filler, we want to be part of the decision making. And I am still Adeniji Ayodeji David. I hope you enjoyed our talks today. And my friend here from Namibia, any last words?
Um, integration is the best way and the new way to go. So I can't wait to go back and, share this with my community and actually, have conversations with stakeholders around, the new integration. That is my message now, that we need more investment when it comes to this new integration, this new word. It's a new word, but we must live this word.
And this is an opportunity to also say, invest now, because life must be saved. Thank you, GNP Plus.
Thank you, GNP Plus, for making this possible.